we get a number of questions about triggering events and why the eczema is flaring up. And a really common one that we hear is, why does it seem to happen at certain points in the menstrual cycle? For some people it's right before, for others it's right after, and others it's sort of in the middle of that cycle. And I would say that we don't really know exactly why for each person it can happen at those times, but there's no doubt that hormones play a role in this condition. And of course, throughout the menstrual cycle, the hormonal milieu is changing dynamically. So I think for certain patients, there is a point in that cycle when they're most susceptible to having a flare-up, and then all it takes is a little bit of bad luck, something else to push them over, and then they will have that flare. But it's a very common thing that we see, and it can be helpful in that when we can predict when it's coming, we can sort of batten down the hatches and prepare for it by getting the skin in its best possible conditions so as to minimize and mitigate against that flare. A very sensitive issue in terms of patients with eczema and sensitive skin is the role of condoms. Condoms, of course, can be made from latex, and latex is, for many people, an allergen that can be both causing eczema, but also can even cause hives in some patients. So if you have a known latex allergy, you have to be very careful with condoms. Less common, but still very possible, is just the fact that wearing something tight and constricting on a body part can be very irritating. And of course, with intercourse and sexual relations in general, there can be friction and heat and fluids. All of those things can irritate sensitive skin. So intimacy between people, especially when one or sometimes both, I have sometimes families where both mom and dad have atopic dermatitis and sensitive skin, it can be a little bit tricky to navigate because so many of these aspects, everything from the latex or the non-latex, but including the closeness, the friction, and even some of the fluids can irritate the skin and cause a flare-up. I think with time and practice and experimenting a little bit, most patients though can find good ability to be normal in that domain and not have to worry too much, especially if we can get the rest of their skin under control. One of the hardest things that we see, and it really is sort of unfair, because we often say if your skin is dry and sensitive, then you're more prone to eczema, but you really shouldn't have acne. On the other hand, the folks with more oily skin, they're more acne prone, but we usually say, well, at least you're protected against dry skin and eczema. That's sort of supposed to be the teeter-totter and balance out, but some unlucky patients get both. And that is very tricky because almost all of our acne medicines, which work very well for the most part, but they almost all have a side effect of dryness and irritation. And I can't tell you how many times where we'll try the gentlest little amount in a patient with concurrent atopic dermatitis, and that will flare them up. So now we're in this very difficult area where we have to thread the proverbial needle to find something that will help their acne without triggering their flare. But it can be done. It takes a little bit of practice, and I usually give a number of samples, and we have to start very, very slowly. Sometimes I'll say you're going to start this just one night per week, then we'll go to every other night, and then we'll go every night as tolerated, and some people never even get there. But usually we can find the right combination of the treatment, good moisturization, and a slow pace to get them through it. Eczema can truly affect anywhere on the body, and sometimes people will ask, can you get it in the private areas, in the groin? And this is definitely possible. In fact, it's not an uncommon place. One common place we see it is the nipples, for sure. So both men and women can have nipple eczema, and it can be very uncomfortable. It's often infected, particularly people that are doing a lot of repetitive exercise. So my marathon runners will often have very irritated and inflamed and sometimes bleeding nipples after a marathon, but people with eczema, it doesn't even take anything like that. Just day-to-day activity can cause it. In the genital area, it can also happen. Again, both men and women can have it there. And of course, it's very nuanced there because the skin is so delicate, we have to be much more careful. What you can put on your arms and your legs is very different than what you can put in a very sensitive area like that. So we often will customize a plan to make sure that we can treat that area appropriately. We also have to make sure there aren't other things driving it. So occasionally things like an infection, be it with yeast or sometimes even a bacterial infection, can masquerade as eczema in the area. So we have a few more things to consider, but again, we can almost always get it under control. And I'm I'm very excited to announce that there is a way through NIA that you can actually, in a very anonymous and discriminate way, ask those questions, and we will get back to you one way or another so that we can hopefully give you some insight and answers and some relief around those topics.